This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
All right, well, good evening, everybody. So, every so often we end up having to put in chest tubes in the emergency department for hemothorax, trauma, blood in the chest. And the idea of the chest tube for that is to get the blood out. If the blood sits in your chest cavity for a while, starts causing problems like, you get some scarring there, the blood can get really thick and clotted and it's hard to get out, or it can cause, infections. So we just want to get that space cleared out. So usually we put in a chest tube, we drain it, patients get admitted. And now there's a question, there's a practice that some places are doing of actually irrigating the chest cavity after you put in a chest tube, put a liter of saline in there, and it kind of makes sense to maybe rinse out the chest a little bit more. I hadn't heard of that until a recent study kind of looked at it. And it was not a great study. Basically, it was done at several different centers that, looked at patients who either had the irrigation done or those who did not. And they looked at follow-up procedures. So if someone has a persistent hemothorax, they end up needing to have a VATS procedure, which is a video thoracoscopic surgery where they clean out the chest, or they had a second chest tube. So we try and avoid those. So the patients who had the washout tended to have a little bit less of a need for follow-up procedures, but it wasn't a great study because it was several different centers and all the patients who had the washouts were at two centers and the patients who didn't were at different centers. So it's hard to know if they just do things differently at that center overall, but it is something that maybe there'll be more studies on. Maybe some of our trauma surgeons you'll see doing here, someone has a big hemothorax, they'll maybe flush it out, or maybe we'll do it. So just an interesting idea to potentially prevent the future complications of someone who has a hemothorax and a chest tube. So interesting. Thanks, guys.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.